All right, Megan, thank you for taking some time to speak with us today. Tell me a little bit about the kinds of headaches and your symptoms that you were having. It was a little over a year ago before you first met me.
Yes. I was having headaches every single day. And about twice a week it would get to the point where I couldn't stand the pain and I would have to break down and take some sort of narcotic medication.
And so, Megan, you'd been to the ER on a number of occasions, right? And had tried a lot of other types of medications prior to seeing me, correct?
Yes.
And so after seeing you and examining you and going over your history, we decided that you could have a few nerves that were causing your discomfort. So we did some nerve blocks. Mm-hmm. And what were your results with that?
It was pretty much night and day. We did one nerve at a time, and the first time we did one side, I came in with a headache, and immediately half my head was completely free of pain. It was the strangest feeling. I still had a headache on one side, but the other side was spectacular.
Okay. And so based upon those results, we determined that you had a couple nerves in your temple above your ears and a couple in the back of your neck that were probably causing your headaches. And so we did surgery to decompress those. What was the surgical experience like?
The nerves at my temples weren't really that big of a deal. Uncomfortable if I fell asleep, sleeping on them. But other than that, it wasn't too bad. The incision for the occipital nerves in the back was bigger. That was a little bit more difficult because the muscles that hold up your head were affected. And so it took a little while to recover from that. I ended up cutting my hair short just to kind of relieve the weight off the back of my head.
And when you said the muscles were affected, they felt tight or?
It hurt to use them.
Okay.
For probably the first couple weeks.
All right. And at this point, you're now 6 months following your surgery. Mm-hmm. And where are you at in terms of your symptoms?
My symptoms are greatly improved. I get headaches maybe a couple times a week. And I can usually figure out what the trigger is, like allergies or something like that. And maybe a couple times a month I'll have to use painkillers.
So we've gone from a couple times a week to a couple times a month.
Yeah, and the painkillers work so much better when I absolutely have to use them because I'm not using them all the time.
Right. So are you able to do things you weren't able to do before?
Definitely. I don't have to worry about breaking plans with people near as much. I don't have to worry about going to concerts or things like that. Those triggers don't seem to bother me anymore. So it's definitely been life-changing.
And so I guess you would do it again if you had to?
Yes.
All right. Well, thanks for talking with us. We really appreciate it.
Thank you.